All right, we're live. And I'm here this evening with Miss Martha Webb. I'm so excited that you're here. And
I'm
I've got
excited.
I've got so much comments and feedback about this live and people interested. And so I thought what we would do to start is just have you introduce yourself, just a little bit about you, and then also really define what recreation therapy is, and then we'll kind of go from there.
All right. Well, hello, world out there. My name is Martha Webb. A little bit about me. I went to the Alabama State University in the fall of 2004. Got my BS degree in recreation. Definitely a mom. I have a 15-year-old. Can you believe that? I have a 15-year-old son. I also have a 7-year-old Shih Tzu. His name is Mickey. Love him to death. Definitely enjoy the field of therapeutic recreation. I've been doing this now for over 13 and a half years. I definitely enjoy the field. One of the things about me is that I also went to Amherst University. I received my degree in professional counseling, so my master's, of course. Transitioned. I had a whole bunch of stuff in mental health. So I started with the University of Alabama Broadporch Children's Center, where I work with children in various diagnoses. I left there, transitioned to the federal prison system, and now I'm currently at the VA. Definitely want to start by talking to you guys about what exactly is therapeutic recreation? I know a lot of people have their idea of what they think it is. When you think about recreation, most people think about physical education, which is typical. You think about physical education, you think about movement, you think about wellness. However, it's in the family, but it's not exactly what that is. All right. So, the primary distinction between general and therapeutic recreation is that TR refers to a specialized application in recreation and experiential activities. These interventions assist with maintaining, improving the health status, the well being, and ultimately the quality of life of the population that is served. So I know I said a lot. So let me just kind of break that down for you. We basically focuses in on 5 domain areas: social, emotional and psychological, mental, physical, and spiritual. Those are the areas in which we focus in on to help with the overall quality of life. And these particular areas assist them in being able to experience that. So we'll talk a little bit more about that as we go along. I just kind of want to give a brief overview of that. So
That's a great overview. And just so I'm for sure, also, is it interchangeable if I say recreation therapy or therapeutic recreation? Are those do those mean the same thing, or do you have a preference about which one we call it?
So it definitely is a distinction between the
Okay.
two. I know a lot of times what people typically see is OTR, RT. So we're going to start with basically recreation therapist. So it's basically a standard treatment team in rehabilitation. It's listed as a rehabilitation therapy services as it relates to Joint Commission. Therapeutic recreation, however, is specifically indicated as it relates to services with individuals according to the Disabilities Education Act. So there is a difference between the two, but we're all in the same family.
Thank you for telling me because I honestly didn't know as I was coming up with questions for this. I was like, I'm not even sure if those are interchangeable. So they're used interchangeably, but there is some distinction between them.
There is a small variation in between the 2.
Okay. And so, one as we were talking offline before this live, I had asked you like, how did you find out about it? Because I know personally, I've heard of like occupational therapy, physical therapy, but I just don't generally hear about like a recreation therapist in that kind of family. So, how did you even come to know about it?
Honestly, when I got ready to enroll at Alabama State, they had just transitioned from the occupational therapy program to a master's level program. So, one of the things I wanted to do is to make sure that I am in a field where I'm able to operate with my personality. I can't just be the type of person that answer the phone like, hello, hi, can I help you? I'm more of a hands-on, I need my personality to shine. So I began to look at recreation therapy and I was like, oh my God, they're like fun therapists. I really like this field. It gives an opportunity to rehabilitate not just the mind, the body, but also the spirit as well. And so you're able to work across many different type of settings. You're able to impact people on different levels. And so I just started getting excited about it. I started doing my research. And of course, a lot of people, when they think about recreation therapy, I hate to say this, Dr. Dooley, they think about automatically activity therapists, right?
Right.
Like, which is nothing, there's nothing really wrong with that, right? Because we kind of we do similar things. However, there's different levels to that. And that just goes back to me explaining the distinction between general recreation and therapeutic recreation.
Right.
And so we are able to provide some of the same level as most activity therapists. They think about that when they look at nursing home facilities, and people just limit recreation therapy sometimes to just that. And so I have to explain to them that there's a therapeutic application when they're working in long-term care facilities that we look at when we do, such as a popular game is bingo. Everybody likes bingo, right? But there is a therapeutic perspective that we look at when we're talking about bingo. So as a recreation therapist, one of the things that we kind of consider when we're getting ready to play bingo is the population that we serve. So if we're dealing with veterans or people in general that's in a geriatric population, we look at, okay, is this person capable cognitively to be able to associate numbers and letters, right? Is their fine motor skills intact? So when we're playing throughout the game, part of my job is to look for that. So if Mr. So-and-so is struggling to be able to place the chip over the appropriate number with the appropriate level, then that lets me know that there's something that's happening cognitively with him. Or if he's struggling to pick the chip up and place it where it needs to go, then that further lets me know that there are some fine motor skills that he's struggling with. And maybe I need to make the necessary adjustments, such as getting the flip card where we can flip down the number or the letter. That we can order some cards to be able to accommodate him with his fine motor skills. So we're looking for more than just that. And that's one of the reasons why therapeutic recreation is so important, because if other paraprofessionals, such as the medical team, is unable to kind of identify that on a day-to-day basis, if I have more contact with that particular individual, I'm able to say when we go to treatment team, hey, listen, this individual was struggling a little bit to pick up the chip and place it over the card. I'm not really sure what's happening. Could you guys put in a consult to find out what's going on? Because he was struggling a lot. And I had to kind of stop, pause, keep going, and try to help him with that. And so that's, I know that's a lot that goes with bingo, but that is the therapeutic application of what it is. They don't know what it is. They're just having fun, right?
Right.
But for me as the recreation therapist, that's what I look for.
I was going to say too, I think how that input could be so helpful. Let's say if we have a patient, and from my perspective, I might see them every 3 months for 30 minutes or whenever, even the facilities or the physician isn't there a lot of the time. And
Mm-hmm.
so maybe the report I would get is such and such used to enjoy playing bingo and now they just don't go. They're just in the room all the time. So,
Mm-hmm.
right, I might think, oh, are they depressed or just,
Mm-hmm.
what the
Mm-hmm.
situation is. But like what you may be able to pick up is it a motor issue? Is it a cognitive issue?
Mm-hmm.
Maybe they're frustrated because they can't quite get
Mm-hmm.
it right. That might be the first time we recognize, oh, there's a cognitive issue,
Mm-hmm.
or
Mm-hmm.
there's a whole bunch of other. Was it Parkinson's? Is who knows what the motor
Right.
issue might be? Or are they
Right.
shaken? Right, and that's why
Right.
they. So that's actually, I think, a really good description of how helpful it is. Right, from the outside
Mm-hmm.
looking in, it's a
Mm-hmm.
game. But like from
Right.
your perspective, you're making all those observations, and I think that
Mm-hmm.
actually is really good, like feedback for the team too. So
Right. And the same is true for social skills. That's another thing. A lot of people may not have the appropriate social skills. I run into it all the time, especially currently in the position that I'm in now, where people may feel apprehensive about being in a setting with people, not just due to COVID, but just in general, of not being able to have the appropriate social skills. And so they typically isolate. They do activities that are more one-on-one or more in solitude, which is fine. If you want to play on your phone, you can. If you want to, watch TV, you can. But the purpose of therapeutic recreation is also social integration, right? So they
okay,
can interact with each other, being able to build those appropriate social skills, because you can't do it by yourself, right? And
right.
so being able to find ways to get this person to be able to socialize. So that was part of the domains. It's the social domain, which is the ability to have the person to enjoy meaningful relationships with other people in their own environment. And so if they're always isolating, then it kind of leads to other issues that could potentially lead to depression, that can potentially lead to anxiety disorders and other things like that. And so part of the fun therapist or the recreation therapist job is to introduce socialization in a way that makes them feel comfortable, and makes them feel like they are part, they're included into the environment. So
I think too, like for the people who don't know, Martha and I used to work together at the current place that she works, and so in the residential program. And I think I was so naive when I first started working there about, for example, people would say, "Oh, doc, I don't have a place to go, or I'm just at home in my apartment by myself. I don't know what I'm going to do." So I would say, "Oh, okay, well, you'd like to do X, Y, and Z. Why don't you just go to, meet up and just go there?" And not really realizing like the basic level of social skills that's required to say go to a place where you don't know anyone and interact with people. That's really something that a lot of
it's
people do
very
not
hard.
have,
No,
especially
they don't.
if you have anxiety disorder, if you have depression or something like that, or just maybe just socially awkward too, and
Hmm.
I think I came to a better understanding, like as I worked there, like, oh, this is a skill.
Yeah,
Like
it
this is
is.
something people have to learn. And unfortunately some people didn't get that, like growing up in their
Mm-mm.
family dynamic. So
Hmm.
so you mentioned earlier that you received a master's in counseling, and so I guess what I want before we go to that, because I do want to go there, with your bachelor's level, the degree, can you practice with that, or do you have to have further education in order to practice?
So, if you want to be certified as a recreation therapist, you have to go through the NCTRC, which is the National Council for Therapeutic Recreation Certification. That is the only requirement after you receive your BS degree in order to practice with recreation therapy. And of course, you have to maintain your license and different things like that. There are some areas where, if you would like to actually teach recreation therapy at certain colleges, they do have a requirement that you have 18 hours or more and master's levels for recreation therapists, but it is not a requirement to actually continue to be certified. So as long as you have that certification, you're able to practice across multiple settings. Those settings literally could be anywhere from schools, hospitals, transitional living centers, correctional settings, long-term care facilities, rehab facilities, wellness centers, as well as community and recreation centers. So those are just to name a few. That's another reason why I have a love for recreation therapy is because it is not a particular field that requires you to stay stagnant. Like you can literally take this and pretty much go anywhere, and be able to provide a level of education and a level of care to the population that you serve.
So why did I guess the question I have is why did you pursue them? Because honestly, I didn't know that about you too. You sent me your bio. Like actually, I learned several things about you. So why did you get the master's in counseling? And well, what was your intention behind getting that? Did you feel like you needed it to further your work you do now, or what was your thought about it?
If I'm going to have a complete level of transparency with you right now, it was actually my master's degree that actually helped me pass my certification, believe it or not.
Okay.
Um, I actually finished my master's in the fall of 2017. And so that was my very last year that I had to take my certification because I had put it off because I was in graduate school. And so, literally, and everybody's test is different. So, don't go to the testing site thinking that everybody's test is going to be the same. But when I got there and I sat down and I started taking my certification, I was like, we're doing this in graduate school. Okay, so now I understand how that particular discipline can intertwine with recreation therapy because it's a lot of that you have to look at. I mean, if you're talking about the psychological piece, the mental and cognitive piece, you definitely want to make sure that you have an understanding of human dynamics and what that consists of. And so my master's degree actually helped perfect what I've learned in my bachelor's. So yeah, I mean, got that. And again, it was just amazing. It was one of those things where I had an aha moment and I was like, well, I'm glad I did. Because again, like we said before, it wasn't an initial requirement to actually practice. Once you got your certification and you have your bachelor's degree, that was it. Another transparent moment, I was at my previous employment and me and the supervisor was talking one day and she was like, I make more money with just my bachelor's degree than my friends that have like 3 and 4 degrees. I'm comfortable with not going back to school. But for me, it was more of, I want to explore deeper how I can be more effective, more meaningful, and be able to provide that level of care to ultimately have my own particular practice where I'm able to have a full wellness center that focuses on these 5 domain areas. So I wanted to set myself up and position myself so that if that is a possibility to be able to open this business up, that I have something that will be able to enable me across all areas.
That's great. I saw that and I was like, okay, I'm going to be sure to ask you about it because I was like, I did not know that. And then you also let me know that you are a certified personal trainer, which I did not know.
I know. And sometimes I eat like I'm not one, but that's okay.
And like, how did you? I guess is that just like a personal like interest, or did you also feel like doing that would like inform your work that you do?
Actually, with my previous employment with federal correction settings, we actually went through, all of us that was a part of the recreation department went through the NFPT training, which is the National Federation of Professional Trainers. And so we had to go through that particular course because that ties into therapeutic recreation and how you can spread your hustle. That used to be one of my classes. But we became basically test proctors and instructors for the female population. So they were able to take that same particular test. So when they transition into the community, they'll have a better opportunity at employment if their legal background permits, such as gyms and wellness centers and things like that. But we had to become certified first in order to be able to legally get them to be able to do that too.
Okay, great. That really makes a lot of that makes
Yeah.
a lot of sense because I was like, okay, did you feel like you had to? So that was kind of like provided. But I would imagine I know in some of our groups you even would talk about like chair yoga and other things. So like it sounds like
Hmm.
that certification, particularly would help you kind of make those modifications for people when you are doing something that's active too. So
It is very useful. One of the things that I always encourage people to do, especially when I was in that particular setting, is to have that. The test, being able to study for it and be able to gather information and education around different things we were not aware of. It was a lot of stuff that I was reading before I got ready to take the test that I was just like, man, I didn't recognize that, being able to know your body type, being able to know what your body is able to consume. Because I know people that can eat a whole cake and gain no weight. And then there's me, people like me who can look at a cake and gain 5 pounds. So just being able to understand the difference in knowing your body type and knowing what you can get and what you cannot get. So I actively work on myself with that information. I try not to sit on it and be like, oh yeah, I'm a personal trainer. And then my waist is getting out of control, right? So I try to make sure that I practice what I preach by making sure I stay active in the gym and doing different things like that. And it's been working so far. So
it
I just
has
got to keep
been.
it.
It has
Yes, you
been.
notice?
I have to tell you, it has been. You look great.
Oh my God,
Um,
thank you.
so I guess, and I know that I'm just going to ask this because I'm sure, like either in the comments or afterward, I'll get questions about this. But what is
Yeah.
the like financial as far as like salary range? And maybe you can
Hmm.
kind of give us an examples, maybe like at the lower range, what kind of typical work would you be doing, and then maybe at the higher range and what that kind of work
Hmm.
would maybe look like.
So it just depends on the state that you're in. It also depends on whether you're certified or not, which is a big one. Most jobs are requiring that you are certified. I know that has a lot to do with just different health organizations such as CARF and other health organizations that come in. It is something that they will require. You would actually make more as you're certified. And again, that also depends on the setting. I know with me, when I was working in the correctional setting, of course, it was a federal correctional setting. Let me just say that because there's a major difference. All right.
Okay.
With the federal correctional setting, I was able to definitely make a lot more than the typical person who works at a state level in recreation. Don't know what that looks like on the state level, but I definitely know between the schools, between a state level, as far as the correctional setting, the federal level, I definitely maxed out in that particular arena. Of course, if you're dealing with the federal level, they have what is called locality pay, which means, of course, it depends on which state that you're in, that they will determine what your percentage will be in addition to your regular base pay. So you can start off in some long-term care facilities, if you're a recreation therapist, depending on their budget, you can start from anywhere from $30,000, which is on the lower end because it's an entry-level position, to a higher end of about $87,000, $88,000 on a federal level with your certification and your experience. And so a lot of times when college students, when they graduate, it's like, man, I'm having such a hard time finding employment, with recreation. There's just not a lot to do. So they typically go to places like the YMCA or places like that to just kind of get their feet in the door. And there's nothing wrong with the experience, but I don't want people to limit themselves in just that particular area. Like, you can literally take recreation and go pretty much anywhere as long as you have that particular certification. You can.
Okay. So it sounds like getting the certification is going to be almost like a necessary thing. So people going into it would know that that will be probably a necessary part of like your career choice then.
Correct. So again, with the federal part, it depends on which particular department that you're working for. So for the DOJ, when I was working for them, I didn't necessarily need a certification because
Mhm.
they had your step grades according to what your maximum pay would be. So you start off as a GS5 and you can go all the way up to a GS9, which is in the state of Alabama, it's going to be about 61,000 dollars. All right. And you can do that within that particular setting. However, you're not just a rec officer in a correctional setting either. So they always tell you, they never pay you for what you're worth. They pay you for what may happen. You got to remember which setting that you're in. And so, of course, naturally, with that being law enforcement pay, you're going to get an increase in your pay because you will be considered law enforcement as well. I thoroughly enjoyed working in that particular setting. It definitely taught me a lot of the skills that I know, just being able to actively engage, being able to also be in a position where I observe. That is probably the most important thing, is to be able to assess the environment that you're in so that you can make the best possible decision, because in that environment, it is literally life or death. So,
Okay. So let me ask you, what brought you to that position? And then could you kind of describe what like a typical day would be? Because I would imagine other people thought maybe like what I thought initially, which is okay, they're locked up, they have so many limits on the things they can have access to. Like, what could you do with them? Right. That's by my naive thought. So
no, no, it's fine. So when I first initially, I honestly didn't want the job initially. I waited until the very last day, 2 hours before the job closed, to apply for the job. My intern supervisor at the time, shout out to Mary Mangrum, I hope you're watching. She actually told me, she was like, "Hey, Martha, I think it's a really good idea for you to be able to apply for this job here in this particular setting." And the first initial thought was, oh my God, this feels like Scared Straight. I'm not working there. I'm not working there. What do you mean? And so I went back and forth and went back and forth. And it was truly a humbling experience because where I completed my internship is where I actually wanted to work. I had gotten comfortable with the population. I had gotten comfortable with, the constituents that were there. I was just like, man, I really could see myself working here. And I guess God was like, nope, I got something else in store for you. So when I got the job, of course, naturally, I was the first person in that particular department. So a lot of the times, the first several months were spent just kind of setting up, being able to what we call SOPs in this particular setting, basically setting up institutional supplements for that department, meaning being able to talk about what our purpose is, hours of operation, our mission, some of the programs that we're planning to offer, rules and regulations around the program, and different things like that. So you're asking, well, what did they actually do in that particular setting if they locked up at that many times so one of the things that we do is we have a lot of wellness classes. Some were facilitated by us, some were led by the actual, offenders. And one of the things that we definitely want to pride ourselves on is our ability to be flexible in that environment, because it could change. You can start off having a great day, and then
You're
things begin
locked
to shift,
down.
right? So you have to be adaptable in that particular environment. But some of the things that which we offered during that particular time frame was hobby crafts. So you had, your regular arts and crafts, crochet, origami, loom beading, those types of things. I actually developed this particular series that they're actually probably still using. I used it. It's called the Life Management Skills. It was actually a booklet that was written by two occupational therapists, but I actually used it and developed a curriculum. So all of the particular prison systems throughout the United States, they are able to access that and use that. But I developed that program to be able to look at multiple areas. I was thinking more just not while they're inside, what keeps them company here, but what will accompany them once they transition to reduce recidivism, because we have to look at the behavior pattern. Most of them may come from impoverished areas where there's not a lot offered. And so you're typically are going to be more apt to do some of the things in which you've done before. And
Right.
so part of that is being able to impart those life skills into them so they'll be able to have multiple options based off of where they are. Most people typically reoffend based off the fact that they like the access to quick money. They look at, hey, um, I got two strikes already, I'm trying to get this money or whatever the situation is. And I can't speak for them because I'm not in that position. But what I can say is based off of the people that, I've encountered who vocalized, hey, it's hard, once you transition, getting a job, you barely making enough money to feed yourself, let alone if you have kids, what does
Or
that look
probation
like?
fees.
Right. You got probation fees. So it's tempting to go back into the same pattern of making quick money, or it's tempting to say, hey, do you want to do this? You know what I mean? And so having those life skills there, having the option to take the NFPT test so that they're able to position themselves at least in a better financial situation, those are some of the things that helps them to reduce that number of recidivism. And so that's what we worked on the majority of the time. We had music where they were able to take guitar lessons, the drums. We had a movie program that we had for them through Netflix where we had movies sent to the institution. They were able to watch it over the weekend, and then we send them back and they ordered more. So we had a system going where they were able to stay actively engaged. We had things like softball tournaments for them, bocce ball. We had soccer, pretty much everything that they would need, state of the art gym equipment for them, just different things that keep them occupied, as well as help them to build those skills in health and wellness so that when they do transition, everything will be fine. We work with the medical department where we had a program where if a offender had issues with diabetes or pre-diabetes or was overweight, we work with the medical team to be able to develop a plan for that particular offender. And we check in every 3 months to be able to talk about the progress. So that particular offender would maybe possibly have an advantage to be able to sign up for more of the health and wellness classes because it's going to be documented that this person is actually in need of some of these health and wellness classes. And from there, we will work with the medical physician to just kind of talk about some of the plans that we have for them so they can regularly check in on the offender. So it was literally a holistic program set up. It also helped with medication reduction. So if they were able to lose weight, if they was able to stay active, lower their blood sugars, lower their cholesterol, lower their high blood pressure, being able to understand what you can and what you cannot order from commissary, having food options to be able to kind of help alter that, it definitely helped with the results that they want.
I think that's great too, and that's really interesting to hear because when I think of prison, even the federal prison, let's just be honest, they're not usually doing rehabilitation, right? That's the goal, right? The goal is for
Hmm.
people not to come back. Just like the goal of getting medical treatment is hopefully you have better management of your condition. So
Hmm.
that's really for me just like great to hear that actually they were taking that
Hmm.
into account and really seeing the importance of that as far as
Hmm.
really helping a person get the skills they need not to come back
Hmm.
to prison. So that's like surprising in a really like
Yeah.
great way. In a
Yeah,
really good
it's a lot that happens behind the scene. I think, we live in a televised environment where people have the perception of what they think it is versus what's actually going on. And so that's one of the key things that I can definitely say that we were able to, particularly offer in that particular environment. I enjoyed it thoroughly. I didn't have I didn't have any doubts that this is not something that we couldn't do. I was super excited about being able to be a part of a great team. And it took a team. I mean, you had the psychology department, education. I mean, it was just an overall team. One of the things that is most important in my profession, if you guys don't document anything else, we use what is called an API process. And so API is just basically APIED. A is basically assessing. When you're dealing with the population that you're getting ready to serve, you assess them. You see what are the needs, what are some of the things that you're able to do in order to make sure that they frequently have what they need. And of course, you look at planning. Once you finish assessing them, you plan based off of what you were able to gather from them. You're able to plan according to what their needs are or what they desire outcome is. Of course, you have I, which is, implementing. You're going to facilitate. You're going to implement what it is that you've planned to do. And of course, once you finish doing the implementation process, you're going to evaluate what is your outcome. Were you effective? How are you able to see what your outcome is? This could be as evidenced by doing surveys, being able to find out how and what ways in which you're able to improve your service, ways in which you're able to implement other things into your services. And of course, last but most certainly not least, the core across any type of job you have, you're going to document. You want to make sure that you're documenting those particular progress. And one thing I love about this process is that you're able to go through each one of these interchangeably. So regardless of what may happen, if you have to go back to assess, just in case the implementation part is off, you're able to go back and assess. You're able to go back and say, I thought this was going to work. That didn't work. So we're going to go back to the drawing board. You're going to go back and assess what it is that is going to work for you or for that particular population that you're serving. And then you can go back through the process all over again. I mean, to me, it is probably one of the most thorough processes that you can have. And you don't have to just use it in therapeutic recreation. You can literally apply this same concept to your everyday life. You can assess what's working for you and what's not working for you.
Right. I'm like, that's very applicable. That could be used for a lot of different
A
things.
lot of different things. And so that is part of why we do what we do. I mean, you have the components of leisure, you have leisure awareness. We're making you aware of what's really available to you because believe it or not, especially in this pandemic, a lot of people wasn't really aware of how they were not in tune with leisure as they should have been. They had every other distraction, such as family, jobs, other things that was happening. So making you aware of what's available to you. And then leisure education, providing education around what it is that you're interested in doing. So that you can find out if this is something you really want to do. And ultimately, it's going to be recreation participation, being able to see if this particular event that you've chosen is something that you actually like to do.
So you mentioned, being in the prison system. I think you were there for about 6 years,
Mm-hmm.
and then you came over to another federal agency,
Mm-hmm.
the Veterans Administration. So I guess what prompted that change?
I always wanted to work with veterans, Dr. Dooley. I actually come from a family where I have many decorated family members. And so I was the person who felt like that is just not my ministry. I wasn't going to the military, but I wanted to be able to support those who did. And so because of that, I always wanted to make sure that I worked with them on any capacity. Recreation just so happened to be the compassion for it. And so, even though I initially wanted to work with veterans beforehand, I feel that it was necessary that the timing was right for me to work at the correctional setting first, because it gave me a lot to be able to bring my area of expertise to where I am now. Because believe it or not, with some of the veterans, you also have to understand a lot of them come from that same background. And it could be very hard sometimes for people to kind of engage and understand what type of treatment to provide for them or understand what's happening with them. So being able to come from that particular background gave me information on how to deal with complex situations like the police.
That kind of brings me to Ms. Webb and I basically worked in a residential treatment setting, so a setting where the patients basically live there 24 hours a day. And so again, you can imagine the importance of leisure and integration and just everything that you talked about already. And so we were laughing talking about this beforehand that like the first outing, okay, because I'm going to ask you about a typical day. So, the very first outing that you went on, that you took a group of veterans to, ended up with, two of the clients basically get into verbal altercation, near physical altercation, some bystanders calling the police. And then I mean, like, in my opinion, it sounded as if you really had to de-escalate the police, not
I
just
did. I
not just the
did.
patients they had went on, but just like the police itself. So, um, when I remembered that as we were talking, I was thinking all them skills came into good use because you had to
Yeah.
de-escalate the whole situation.
The entire
Uh,
situation. The
uh,
entire situation.
we know that's atypical. There, at least to my knowledge, nothing like that has happened since then. But like, what's a typical day for you now? And I thought maybe if you could tell us like pre-COVID, just because I know COVID has changed so much. Like
Mhm.
pre-COVID, what would like your typical work day and schedule look like?
So pre-COVID, my typical day would consist of basically meeting with the population in the mornings just to kind of check in with them. Myself and other paraprofessionals would check in with them to kind of find out what's happening with them, make announcements about some of the things that we have happening. And of course, knowing me, I always had church announcements. I'm always the one talking about what we have happening in recreation. So one of the things that I always try to do is make sure that I have monthly calendars printed for them so they can have access to be able to get a snapshot of what's available for them for the upcoming month. And so, of course, answer questions around that. From there, based off of how many admissions that we have for that particular day, do basically my recreation assessment. So going through that comprehensive assessment, asking questions in reference to current coping skills, barriers, anything that may have kept them from participating in leisure activities prior to treatment, asking them about their typical day prior to treatment so that I can understand what's what. Why is this person not actively engaged in leisure? Asking them questions around things, what they've done in the past, present, or future for leisure. We talked about educational status. We talked about some goals that they may have in mind, some things that they want to see themselves doing in the next 3 weeks or the next 4 weeks or whatever their length of stay is. And so from there, once we complete that, depending on the type of day, I also do gym orientation. So being able to take them into our gym area and just kind of talk to them about the importance of health and wellness, especially now since COVID. People have gotten that COVID weight on them, but pre-COVID, basically talking to them about the importance of exercise, basically working with our registered dietitian also to kind of tag team if we have a person that's interested in losing weight and interested in how they're able to do that in an effective manner. Treatment team, of course, that's always fun. Yay. And be all excited.
Yay! Yay!
Treatment team, where we're able to just kind of sit down and go through just patient care information and be able to kind of talk as a team based off of what's presented for the day. For me, as far as the recreation outings, there are many, many, many facets that are connected to a therapeutic recreation outing that I think people just be like, oh, she just called the people and they just come pick them up and then they just go. And it's like, no,
I
not
kind of thought
quite.
about that too, and it's like we got to think about how long they're going to be gone and what they're going to
Mm-hmm,
eat, and if they have
mm-hmm,
diabetes, who's going to get their
mm-hmm,
medicine. It's like
mm-hmm,
so many different like facets to their,
mm-hmm.
yes, especially with this population.
Right. And so I often tell them, hey, I know I make it look easy because I'm compassionate about what I do. However, there's a lot of footwork behind that. So one of the things I always talk to them about is just making sure that they're able to understand which outing is appropriate. So I oftentimes, when I'm looking at therapeutic outings, I'm looking at what's appropriate for this population, meaning being able to go and see what the terrain looks like. So if we have veterans that are having assistive devices such as walkers or wheelchairs, what that would look like for them. Also making sure that I'm looking at what happens if in the event it starts raining. What is your contingency plan for that if it's outdoors? Being able to look at if they have walkers, would we have a transportation to be able to assist with driving the larger bus that has the lift to be able to assist them in those outings? Because one of the things we want to be careful about is to discriminate unknowingly. So if you're constantly choosing outings that does not help them being able to experience these outings, you also have to look at that piece because you want to make sure that you are accommodating every person when you're doing the outings. Also, getting with the registered dietitian. This is especially important because there are different veterans who have different diets, which means you want to make sure that you're getting something that's going to be feasible for them to eat. And not just with their diet, but physically, if they have a chewing deficit where they can't swallow effectively, or if they can't chew their food effectively, you want to make sure that you get a meal that's more conducive for where they are medically. So these are all things a recreation therapist have to consider. And I know some people like, yeah, Lee, I just thought you was going to take them somewhere. No, these are literally
And we
the
made that
things.
mistake like several times, not being like, because not thinking it all the way through, and then people are out
Hmm.
there, and then they don't have an insulin pen, and they come
Nope.
back, and you're
Yep.
just like, oh, we didn't need to. I think we had checklist eventually, because I mean, we
Yeah.
just was, yeah. So
It's a lot to consider being able to understand once you get out there, what does that look like? If in the event there's a medical emergency, if in the event may not even medically be related, but if in the event you have a flat tire, because we just recently had that experience back here several months back when we took the veterans for fishing, whole tire and blew out. What you gonna do? Having a plan in place and being able to have an amazing team behind you, be able to say, hey, you do this and I'm going to do this. And then we'll do this and we'll wait and we'll do this. And being able to have a plan so things can run effectively. I tell them all the time, I cannot do my job effectively without the help of the people that I work with. They do an amazing job just assisting me, giving me at least 7 minutes to make my church announcements, just carving out a little time for me to
get your
get,
program to go through
get
your
my
whole
program
program.
together.
You know,
I love
um,
it.
I'm not sure if this has changed since I've been there, but at least the whole time I was there, we worked together few years. It's like there was no budget. And so
None.
basically, okay, is that the same?
Well, I think my supervisor did a little razzle dazzling.
Okay.
And so I've seen an increase. So shout out to you, ma'am, for
Okay, great. Shout out
making
to
it happen.
her.
I know she did.
Got
I
a little,
looked
got a
at the
little sprinkle on there.
it was a little sprinkle.
But let's just be honest. I mean, I think it's fair to say that even if you got some funding, it's very limited for the amount of things that you're able to do. And just so people are clear here, I cannot even like express to you the degree of elevation that you brought to our program
Mm-hmm.
and our team when you came. So not just like your personality and your approach to
Mm-hmm.
things and being so solution focused. I think I told
Mm-hmm.
you that before. Like I love how like strength focused you are and solution focused, but you have elevated the program, like period. And I see that Dr. Biddles is here and like giving you some kudos, but
Hey,
I want
Dr. Biddles.
I want to say it
Hey,
to you
girl.
directly that you straight up elevated our program like degrees, okay,
Thank
exponentially.
you.
um
Thank you.
and part of that I think is how you were able to navigate like the relationships and building with things with people in the community. So can you just speak to that, because I would imagine it's not uncommon that somebody
Yeah.
doing therapeutic recreation would have very little budget or resources, and
Right.
can you just kind of talk through that and your process with some of
Sure.
that?
When I first got there, yeah, we had no budget. Bless our hearts, and everything in between. We had no budget, and so it was one of those things. Was like, okay, that's why you have to be creative as a recreation therapist. Your level of creativity is it has to be on point, and it has to be in a position where you say, okay, we don't have this, but what do you have that could potentially benefit that particular program? And so I'll never forget, she said, well, yeah, you could probably get with Dr. So and so and see what he got to say and da da. And so he was able to provide me with additional information around some veteran service organizations and different things like that. But I actually had to network, so I had to put boots to the ground and go to networking events. Being able to go out there, introducing myself, bless my heart. I didn't even have business cards at the time. Like I was literally out there just
And
like Lord.
and for people who are watching this, don't realize it can be really hard to get your business cards, okay, in the federal system in a timely fashion.
I got mine 2 years later. So yes,
So that people don't understand the degree to which is like she really did not have it. Don't get me
I did not. I was around there winging it like, oh my God, okay. So I have some
started. Right.
sticky notes. So I can
Exactly. Exactly. That's
so I
real. That's
I
real.
can write it on the sticky note for you. And it was just like, listen, y'all, I need y'all. If you're not gonna give me no money, at least send a sister out here prepared to like
Exactly.
have a business card. You're gonna have me around here cutting out index cards. Right?
I mean, isn't it real though? But see, I think people don't
Yeah,
realize like what you have to work with and what you're trying to navigate. And like that's a small
right.
thing, but yeah,
But
it's
I
real.
mean, presentation is everything. They're looking like, now, yeah, Lee, now y'all ain't that bad off that you got to write your stuff. index
It's like,
card.
this is what we are. Please give
This
us
is what
money.
we are. Like,
Give
give
us
us
money.
some money. Yes. And so one of the things that I did, I went to veterans networking events, and basically, of course, I can't solicit as a recreation therapist, but the actual volunteer services department can. So one of the things is I always wait on that keyword. What are your needs? When they ask me what are my needs, then that is the green light for me to say, oh, glad you Yes. And so I talk about the current program, what are the services that we offer, some of the things that we would like to do as a program moving forward, just to be able to keep people in the loop and to keep them a part of that community-based integration. And so the program that I work for is community-based, even though it's a CBOT clinic is also considered inpatient, but once they transition from where they are, they still have to go into the community. And so one of the things I want to do is make sure I have those resources readily available. So when they transition, they'll have additional support once they go back into the community. And so again, boots on the ground, basically going to these particular events or anytime they have questions around, hey, who's your POC for the DOM? Typically they'll hit me up like, hey, we got somebody, they want to know a little bit more about your program, blah, blah. And so I'll go into details, just basically talking to them about the level of expectations for the program, our mission, our vision for the population that we serve, and to just really talk to them about why it's essential for us to have these particular services. We have partnered with the YMCA to be able to provide them health and wellness due to the fact that our gym was kind of small. And so with having the number of people that we had, it was essentially important to be able to partner with outside community resources such as that to be able to provide them and expose them to more than just that. They had cycling classes, they had Zumba
The pool was
classes,
there.
they had a therapeutic pool, they had an Olympic sized pool at that particular YMCA where they were able to do water aerobics and everything else. They had a sauna, they had a steam room. So all of this is also a very important factor and component into their treatment as well, because if you had veterans that were pre-op or post-op, these particular services were extremely beneficial, where PT could put in an order and say, hey, a therapeutic pool would be very beneficial for this veteran for the next 2 to 3 weeks prior to them having surgery or prior after them having surgery. And so these community resources, having those things will actually help us to be able to better meet the needs of the veteran. So being able to do that consistently has also helped me grow some, to help me to understand how to be more creative. In this field, you have to be creative because you're going to be met with all type of barriers. And I think a lot of it is because people are misinformed about the field itself. A lot of people don't know what rec therapy is. A lot of people don't know what recreation therapists do. And so because you're met with that level of ignorance, just because they don't know, you will find yourself in a lot of positions where you have to constantly explain what is it that you do. And of course, you have some people who will provide a level of mockery of your particular discipline.
Yeah.
But if you are in recreation therapy and you stand proud in the field that you are, please have no worries in being able to correct them. I do it very often.
Yes, you do.
Okay.
And you have like the best way of like giving direct feedback and a redirection to people. I mean, but it's so polite, but it is just
Yeah,
very direct.
it's
And
very
it's just
direct.
like you're not gonna be confused about it. Like
No,
this is
you
what's
you won't.
happening.
We'll be able to provide a level of information for the misinformed. That is my job.
I love that. A level of
Yeah,
I'm gonna take that quote. A level of information for the misinformed. That can be used so many different ways.
yes, it can. That's why I used it.
And
Yes,
then maybe could you tell us, since COVID is here, and hopefully things will be getting better soon. But like, how have you kind of been able to navigate your work like with during the time of COVID?
so currently, since COVID, obviously there's a lot of restrictions around what we're able to do within the community as well as on site. I know our census level dropped significantly when COVID first happened, just to be within the CDC guidelines of social distancing and all of the different things. And so for me, I really had to reach a level of flexibility and to reach a level of creativity because we were in that position. Of course, naturally, when COVID first happened, nobody knew what was going to happen. Everybody was just like, I don't know, and so it reduced the amount of trips they were able to take out to the community, like for comfort items and different things like that. They were not able to do typical things like going and getting a haircut or going to the shop to get their hair done and different things like that. And so that looked very different for quite some time. And so already having those veteran service organizations established helped me to be able to assist them, because they were like the driving force behind me being able to get the assistance that I need. They immediately reached out and say, hey, what are some of the things that you need? And of course, I was able to vocalize that based off of where we were in that moment. So comfort items such as snacks and different things like that, that they were not able to go out and get, personal hygiene items that they would particularly need according to what they desire. I was able to secure some of those for them as well. We even had to start with, doing a lot of telecare. So basically, telehealth became a really big thing. And of course, that's a transition within itself, because you have a lot of the population that I work with were just not a part. Their computer skills were just not up to par. And so it's a frustrating transition for them, because they look, I need to see somebody. I got a little flip phone and I'm good with using this flip phone, and that's it. And it's just like, I understand, but here, let's try this. And having that level of patience to be able to say, hey, we're going to transition from here to here, and I'll be here to help you with that. So the team, they really stepped up. We had an organization to donate some tablets so that they're able to access, being able to Skype their family and friends during that particular time frame, and also be able to, have telehealth appointments with their providers as well. And so being able to teach them how to actually navigate through, the tablet and the benefits of leisure with the tablet was super important. And so that actually became a class. It was Intro to Leisure and Technology, where
Nice.
I had
Nice.
to sit down, and we would meet once a week for about an hour, where I would sit down with them and we would just navigate through the tablet, understanding what apps do what functions on the tablet does what. It was a lot of work, but it was something that it was an adjustment for everybody. So literally, when I tell you, it was a learning phase, not just for, the clinicians, it was also a learning phase for the veterans as well, because they were the ones who had to kind of play catch up, all at once. And so you go from having face-to-face care all of these years to now you got to sit there in front of a screen. It was definitely challenging to kind of promote that. But part of what I did is to get creative and say, listen, look at this as an opportunity for you to connect with some family members you haven't seen in a while. If you don't have social media, you're able to now download social media, see what's happening with everybody, stay connected to the world, stay connected with your family and your friends. You're able to FaceTime your kids if you need to. Look at this as you interacting with the world with your tablet. And so some of them were on board. Some of them was just like, you just gonna have to give me a minute. I'll
That's
get
true
there,
for staff too, though, right? I think it was like you said, it was a very hard transition, not just
Mm-hmm.
for the veterans, but for staff also. And
Mm-hmm.
I think too, in the population that we serve, it's skewed older, and
Mm-hmm.
like having a flip phone. Like some of our patients, like do not even have a smartphone, and I'm telling
Mm-mm.
you, walking someone through like enabling your camera. I mean, even if you
Yeah.
don't know, like that's just like a basic level of computer literacy that a
Mm-hmm.
lot of people, even just ain't older, don't have. When I turn it on and I say unmute your mic, that's a
They
skill
don't
because
that
no, they
they
don't
don't
know the little
know.
icon. And when I even say
Well,
icon,
they'll
I'm like,
they'll get real close to the phone, like, now what you
right,
say, where I go?
right. I'm like the icon. It's like so. What I have to do is like call them on the phone, right? And hopefully they're
And
not
walk you
using their
through.
phone; they're using a
Right,
computer or a tablet.
right.
And then I have to say sometimes like put your phone on there and show me. Okay, touch that.
Yeah,
Okay, now you can see me. I mean, and so I
yeah.
think the importance of that, during that
Mhm,
transition, I know was like
mhm.
was very important because
It was, and then with the therapeutic outings, for the longest, we were not able to go absolutely anywhere. All of the volunteer services organizations, or the veteran service organizations, they were not permitted to come on site. It was just, it literally turned into, you had your telehealth, you can kind of go outside and get some fresh air, and then back inside the building. And so for the longest, it was like, what can I actually do to assist in this particular process? And so the tablets definitely helped with those individuals who wanted to watch TV, also provided leisure resources. And so we have a national recreation therapy group that basically we're able to share different leisure resources with each other. And so there was a couple of recreation therapists that were were from different districts that were able to kind of formulate a leisure pamphlet, and where we were able to send out a mass email to the veterans where they had access to services such as taking free classes from Harvard or Howard University. They had access to be able to see theatrical plays, concerts. They could do like a DJ power hour where they would play music virtually. So have a virtual dance party. They were able to do Zumba. They had access to cooking classes through that leisure pamphlet. So it really kind of got them into the mode of learning what they're able to do outside of just watching your normal Bonanza, your normal Gunsmoke, your normal, your
Which are
normal
good
stuff.
shows, by the
Which
way,
are good shows, by the way. My mom still watches those shows, but I'm just saying it gave them something else
My
to
mom too. My
do.
mom only will watch it like black and white. She won't watch it when
Yeah,
it comes. No, she's like, I have
yeah.
to watch it in black and white. I'm like,
Yeah.
okay,
It's
yeah.
just the original part of it. So, and then with the recreation outings, at some point we were able to say, okay, here's where we are. We had to look at the numbers very frequently, and we had to choose venues that provided that level of social distancing. And so, even before we can talk about the outing, we even had to talk about the transportation piece. So, even though we have like the social distancing within the residential part of the program, when you're transporting veterans, they still had to be at a particular distance, which is the 6 foot apart. And so when transporting veterans, we definitely had to consider, okay, so we can't transport 8 people in this 15 passenger no more. We down about 3, and that's including the driver. So when you're planning community things such as medical appointments or different things like that, that is something that we had to consider. We had to make sure that we followed the protocol of the transportation department in order to make sure everything's in line with what we needed to do. And also choosing outings that were outdoors were more conducive for us during that particular time frame, so that people can socially distance, people can get some fresh air and just kind of feel like they can breathe, because it could be stuffy sitting in the house all day, sitting in the building all day, nothing to do, just concerned about all of that. And so another thing that I had to do as a clinician, because let me just tell you, in the field of recreation, people would treat you like a cruise ship coordinator. They were like, well, what we gonna do today? And it's just like, no, that's not how therapeutic recreation works.
Right. You're
Like,
participate. We're partners.
we are partners. That goes back into the part of the leisure components. You have leisure awareness. I make you aware of what's available to you. Leisure education, I educate you on what you're able to do with what you know. And then recreation participation, which requires your level of participation. And I have to always reemphasize that, because people will lose their sense of autonomy if I'm always directing them on what to do. And once you transition, you need to be in a position where you're able to independently make healthier leisure choices. And that is one of the reasons why leisure education is important. You are in a position where you take that power back and you make the necessary leisure choices so that you can have what you need. If I'm always telling you what to do, when you leave, you're going to be calling my extension like, now this is my 3rd time calling you, Miss Webb. Listen, I'm trying to see what was the name of that movie. And it's just like, no.
Which does happen. Like when they leave,
Right.
that doesn't mean they won't still call and be like,
They're going to still
"You still
call.
my recreation therapist. What can I
Yeah,
do?"
what
Right.
can I do? And being able to, upon discharge, being able to say, hey, what is the area in which you're getting ready to transition into? Have you thought about some of the things that you're wanting to do in the area, which can be particularly challenging if they don't have their own level of transportation, right? So if you are looking at being in a position where you're staying on the MARTA line or the MARTA bus line or train line or whatever it is, that means I have to now say, okay, so have you considered some of the things that you're able to do if you have adequate transportation using these particular services, and being able to help them identify some things that they're able to do in the community, which I have. We've had veterans who were able to participate in outpatient programs. Of course, we do have an outpatient program there at Fort McPherson where they're able to access those particular services. And those particular rec therapists are extremely awesome, where they're able to provide them that too. We have the swim with the whale sharks experience that we do pretty frequently, which
That's awesome.
I
I'm like
know.
amazed every time I see those pictures. I'm like,
Yeah.
yeah.
Yeah, it was a lot of fun. I actually had to practice what I preach. The last time I actually had to participate because we had a veteran that was not able to at the time. And so she was like, you getting in or what? And I was like, all right, I guess I'll go ahead and get in here. All right. I'm not
And what
Jonah,
we're
so don't
basically talking
swallow
about
me.
is swimming with like, it's not like the
Whale
whale
sharks.
shark. Yeah, the
Yeah.
huge shark. It's part of
Yeah.
one of our aquarium programs. So yeah.
Yeah, it was an amazing experience. I definitely did not want to experience Jonah Experiences. So I was praying the whole time, like, yeah, see, nah, so I ain't going down like this. So, like, look, you stay over there, I'm gonna stay over here, and we
Did
gonna
you
be
swim
good.
just on the top, or did you actually go into the tank?
So they actually have a program now that they're getting ready to actually facilitate for us, where you're able to actually get into the cage and they drop you to the bottom of the aquarium, and then white sharks are able to swim around you.
You kind of like
Yeah,
scuba dive in there.
yeah, so I don't have that. That's not my ministry. So I will not be participating in that. But the one that I was able to actively engage in, it is an actual swim. So they will put a life jacket on you. You'll be in your full wetsuits and different things like that. And it's more surface level. So even if you wanted to try to dive in, you wouldn't have the access to do that. But
Okay.
I had to remember, and along with the veterans, is that this is their home. This is their area, which means we're sharing a space of them. And so we have to be mindful of that. And if they swim right up under you, you just kind of put your hands up, across your hands, and do something. You can't
Keep
touch them.
praying. Just keep
Just
keep
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 praying.
praying.
You know, the Lord will hear you. If he heard Jonah, he'll hear you too.
But I think that's just like one of the most, kind of awesome experiences that some of our veterans have got to have. And let me tell you, for some of them, that has been like the highlight. Like that is something that even when they come back or you see them later on, they remember that experience because it's
Hmm.
actually really expensive. A lot of
It
people just day
is.
to day would not be able to even afford that. So the fact that you've
No.
like nurtured that relationship such that they can have that amazing experience is really awesome.
It is. It's great. I tell people all the time, I absolutely love my job. It's really not a job because I find myself working even when I'm not supposed to, which is something that I'm working on professionally, is being able to learn how to disengage, because it's easy for you to be like, oh, it's okay. I'll just do, it's not a problem. And then you find yourself in a position where it's like, dang, I ain't really get to do nothing on my off day. So being able to learn how to disengage, that's also a skill, because as a reg therapist, you're always engaged. You're always trying to figure out ways. You're more solution oriented than, focusing in on the problem. You always want to make sure things flow cohesively, whether you're on site or not. And so that is probably one of the best things about my job, is being able to provide that level of care for them that's long lasting. And I've dealt with where I've had to interact with, people that have now transitioned from life into another life. And one of the things I always ask myself is, what did I do that was impactful while they were here? Right. How did I do my part to make sure that their life was meaningful before transition? And to sit there and look back at that, it's just like, man, you don't know. And so that's why when you have people here, you do as much as you can while you can, and make that difference. That's what that quality of life is all about.
Oh, I love that. Look, just like it got a little bit of a chill. And that's like I think a great way
Yeah.
to kind of, really just kind of wrap up some. So we're kind of coming to the end of our time. I could talk to you
Yeah.
forever.
I know, but we can't talk to them forever.
But I think thank you so much for being here. Thank you so much for sharing just your personal journey and just some helping us understand the difference, recreation therapist, therapeutic recreation, and
And the
you know
difference between the activities therapist, add that in there
yeah,
too.
and the cruise director,
And the
and
cruise
it
director.
is not
Yeah.
that.
No, it's none of that.
Um, and I just want to say again, I guess, is there any last things that you want to say? Or I know Miss Webb said she was open to sharing her contact on social media, so I'll be sharing that on a post after we get done. But anything else you'd like to share?
Just for those who are actually considering the field, so whether they're students watching me or someone else who just desire a career change, it's definitely something that's life changing. You definitely have to have a heart for it. It is a servant's field. You definitely want to make sure that you're compassionate about what it is that you're seeking. I know a lot of students who are looking at entering into the field. Some of them enter into the field just to get a degree, and then they transition to another place, and that's fine if that's what you desire to do. But recreation is definitely a rewarding field. You get an opportunity to see more, be a part of more, and it's literally a multifaceted area where you're able to experience life on a different level. It has definitely changed my life. It has helped me to make better choices, professionally and personally. Being able to understand the dynamics of self care and being able to take some of the principles in which I facilitate and make it applicable to my own life. So, if you don't take anything else from this particular video, please take this. The API process is not just for my particular population. It is for every part of your life. Assess, plan, implement, evaluate, and document. If something is not working for you and it no longer serves you, then disengage yourself from that, reassess what you need, and implement the things that you want.
Thank you. I love that. And again, thank you for being here. And some of your team members are in the comments. You'll see some of those after,
Oh, hey, y'all.
and
Thanks for
they're
the
giving you some
support. I love
positivity there.
y'all. I love y'all. Y'all gonna be cracking on me when I come back to work
I
Tuesday.
already know how it's going to be when you get back on there. But I do want to say, like, just during our time that I worked together, that I really appreciated the work that you do, and you have really elevated my understanding, not just today, but even just working with you. And I know that you're making a difference in the lives of the people you work with, and the people that you serve. So I just wanted to say that directly to you as well.
Thank you, Dr. Dooley. And you've helped with the field too. I know you like to remain modest, but Dr. Dooley actually helped me with a program one time. She just stepped up and was like, look, we ain't got time to keep going through all these people. Let me just say, okay, what you need? Okay, I got you. That's fine. Yeah.
Yeah, we'll have time. We have a purpose, a place we're trying to go to. So thank
Right.
you for
I
that. But
appreciate you.
I appreciate you too. So, all right. So we're gonna sign off now. And again,
Bye, everybody.
I'll put the contact information in a post, and we'll be seeing y'all next time.
Bye.